I'm Takashi Ono from the Department of Orthodontics, Tokyo Medical and Dental University.
I'm Yuji Ishida.
We have discovered that gene delivery therapy can effectively suppress inflammation to enhance tissue healing after tooth extraction. Tooth extraction is a common surgical procedure in dental medicine. When a tooth is removed, sores are formed on the socket, which triggers a physiological healing process involving the reconstruction of damaged soft and hard tissues. One phase of wound healing, known as hemostasis, begins by stopping the bleeding from the blood clots, which stimulate an inflammatory phase. This can help prevent further bleeding, but complications can arise if prolonged. After tooth extraction, excessive inflammation can cause residual ridge resorption or a reduction of the residual bone in the jaw, which can induce a negative and aggravating impact on dental treatment. Bone remodeling, which occurs throughout life, is mediated by a signaling pathway that involves the protein complex NF-kappa B. It controls the production of genes that regulate inflammations and bone healing. Inhibitors of NF-kappa B are widely recognized in the treatment of bone resorption. However, the application of an NF-kappa B decoy, ODN, is poorly investigated.
In this study, tooth extraction was conducted using molar extraction surgery. A gene drug delivery system was developed utilizing an efficient copolymer vector, a type of poly lactic-co-glycolic acid, to deliver NF-kappa B decoy ODNs, double-stranded DNA fragments, to the extraction socket of rats, and their therapeutic effects were investigated. The bone fluorescence labeling results show that the local administration of NF-kappa B decoy ODNs using a copolymer vector promotes bone formation in the extraction socket of alveolar bone. In addition, the trap staining showed that the gene delivery decreased the number of activated osteoclasts in the extraction socket, indicating an inhibition of bone resorption after tooth extraction. This was also supported by the RT-PCR results, which showed a decrease in cytokine production related to bone resorption and an increase in the production related to bone regeneration.
To wrap up, this is the first in vivo study revealing the efficacy of NF-kappa B decoy ODNs administered by a copolymer vector to promote bone healing after tooth extraction. The findings of this study may lead to innovative gene therapy to prevent residual ridge resorption after surgical tooth extraction. Thank you for watching.